Now, on World Tuberculosis Day, observed annually on March 24th, global attention turns to the urgent need to eradicate tuberculosis, the world's deadliest infectious disease, known for its devastating health, social, and economic consequences. In commemoration of this year's theme, Yes, We Can End TB, Commit, Invest, Deliver, the Gambia's Ministry of Health launched a tuberculosis screening and outreach campaign in Brufut. Lamin Bah reports.
The initiative, spearheaded by the National TB and Leprosy Control Program and partners, featured door-to-door awareness drives, advancing diagnostic screenings using the cutting-edge expert MTB RIF assay, and systematic case identification beyond regular health facilities. The screenings didn't stop at tuberculosis. They extended to other health concerns like HIV, diabetes, and hypertension. This approach heightened community engagement, fostered trust, and emphasized early diagnosis to keep TB transmission. Marie Gomez, acting program manager of the Gambia Leprosy and TB Control Program, stressed the importance of seeking health care for persistent coughs lasting 2 weeks or more.
It's everyone's business, it's everyone's responsibility. Let's get the word out there and make sure our people, when they're coughing for more than 2 weeks, take them to health facilities and get them tested. Children can also be tested for TB. When they're exposed to someone who has had TB, or when we see those specific symptoms of cough, failure to thrive, take them to the facilities. Even if they cannot produce the sputum, their stool samples can be used to be tested for tuberculosis. So that's a major breakthrough that I think the whole population should capitalize on and make sure no one is left out, especially our children.
Alaji Job, a senior researcher at the Gambia's Medical Research Council, highlighted outreach efforts as crucial for meeting those unable to access hospital facilities.
Them to come to the health facility. When some people will stay at home, going to the marabouts, going to various health facilities, or even not going to the health facility and sit at home. And some people are staying with other people, especially the vulnerable people like children and the old. So we need to get them out and screen them and treat them as quickly as possible. Because it is said that the earlier you get them and treat them, the better you reduce the transmission rate in the country.
The Alcalo of Brufut, Lamin Bah, expressed gratitude for the initiative, but noted that women overwhelmingly outnumbered men at the screening center. He urged men to recognize that TB does not discriminate and emphasize the importance of regular health checkups.
Woto nyanda yele ko ka tandi fay abedan tilbi ko don bambar tinantinga kalam taro ke nyami ka tandi kenni musol bele be ma be yin kusiba akala ke musol damati kenni musol be bungo kono ni musol man musol kenni ar ke man kenni kura manda abal fe yel wode wala ta jakal la molla nanyad bari minu nata nche tentu ngejay ke kilin mulate kono ngeten.
Mr. Seni Cham, Senior Leprosy and TB Control Officer, revealed that nearly 29% of the TB cases in the country remain unreported. The Brufut screening exercise exceeded expectations, uncovering hidden cases and strengthening community resilience in the fight against TB. Cham and the Alcalo reiterated calls for men to step forward for testing and treatment.
To look at our TB case finding, virtually we have about 29 cases, or 29% that are missing TB cases. So these missing people, virtually they are in the communities. So this is why this screening exercise is very, very important. We want to make sure that now we come very close to where patients are in order to have those missing people. Because if we should sit in our health facilities, to have these people coming will be very difficult. So this is why the office deem it extremely necessary to go out into the field, embark on what we call active TB case search, so that we can come across those missing cases of TB. So imagine if we are able to come across even 2 cases of TB here, it's going to do a great lot, because these people will be put on adequate chemotherapy. Then the chain of transmission of tuberculosis will also be broken down.
TB caused by airborne Mycobacterium tuberculosis continue to pose a serious threat globally. It spreads easily when individuals with long TB cough or sneeze, requiring only minimal exposure for transmission, declining international funding, excavate the challenges, but strong local efforts like those in Brufut underscore the importance of community-driven initiatives to achieve the goal of eradicating TB by 2030. Lamin Bah, Star TV News.